The top stories tonight in Y News. A study shows that the COVID-19 variant discovered in Kent, United Kingdom is prevalent among Italy's young population.
Vaccines from British-Swedish drug maker AstraZeneca are set to arrive tomorrow in the Philippines, according to two government officials.
A study shows that Sinovac appears to be more effective than AstraZeneca against the variant from South Africa, now detected in the Philippines. Metro Manila mayors are set to implement different ordinances on the reopening of cinemas on March 5.
Department of Education urged to conduct more granular approach in identifying areas for the pilot implementation of face-to-face learning.
And know why obesity may weaken the efficacy of Pfizer vaccines based on a study. Good evening, Philippines and the world. We are now reporting live from Barangay Bahay Toro in Quezon City. Today is Wednesday, March 3, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. Italian health authorities say the variant of the coronavirus discovered in Britain is prevalent among infected children in Italy. They also warned that the curve of contagion is showing signs of a robust uptick. Marvy Delfin will tell us why live. Yes, Marvy?
Harleen, the incidence of new COVID-19 infections among young people in Italy in recent weeks has overtaken numbers seen among adults and the elderly, which is a complete reversal of what was seen earlier in the pandemic. Italy's health minister Roberto Speranza said the government has ordered more school closures as the highly transmissible UK variant has shown pervasiveness among the youngest age group of the population. All schools in the highest risk regions will switch to online classes, with some exceptions made for students with special needs. Distance learning was already mandatory for attending high school in red zone areas, but younger pupils are now included. The tougher measures under the decree of Italy's new Prime Minister Mario Draghi has come into effect on Saturday and will last until April 6. The country is now seeing around 15,000 new cases per day, and the trend is rising, putting the health system under strain. According to Silvio Brusaferro, president of the Italian government's Superior Institute of Health, the Kent variant accounted for 54% of confirmed cases as of 18th of February, but he added that more up-to-date analysis would reveal a higher percentage. Meanwhile, some cultural venues like cinemas and theaters that are in yellow zone regions will be allowed to reopen from March 27, but capacity is limited to 25%. Recreational facilities such as pools and gyms remain closed. Travel between regions is banned, and a curfew between 10 p.m. and 5 a.m. is still in place. Harleen?
All right, Marvy, thank you for that report. After days of delay, the AstraZeneca vaccines will finally arrive tomorrow, March 4. Malacanang has confirmed that the country is set to receive 487,200 doses of the vaccine as part of the first round of allocated doses from the COVAX facility. Senator Christopher Bongo said he and President Duterte will welcome the arrival of the vaccines at the Villamor Air Base in Pasay City tomorrow night. However, vaccine czar Carlito Galvez Jr. cannot confirm the delivery yet.
I cannot confirm yet kasi alam mo, 2 beses na kaming na kuryente diyan. So, ang namin is pagka lumipad na yung aircraft sa Belgium, that's the time that we will confirm.
Last Sunday, the country received its first supply of vaccines with 600,000 doses of CoronaVac donated by Chinese firm Sinovac.
Now that the AstraZeneca vaccines are arriving in the Philippines, a COVID-19 research expert urges cautions that these vaccines may not give full protection against the B1.351 variant first detected in South Africa, which has now entered the Philippines. Aiko Miguel will tell us why.
AstraZeneca shows 70% efficacy in protecting an individual from getting infected with COVID-19 based on clinical trial results. But its efficacy is reduced to 10% when inoculated to a person infected with a B.1.351 variant, or the variant from South Africa.
Basically, South Africa decided to abandon the AstraZeneca vaccine because it was no different than injecting water into the patients. Because with 10% protection, basically most people would still be able to get mild and moderate COVID-19.
According to the UP Octa research, a booster shot of AstraZeneca is needed for better protection against the B.1.351 variant. This means 3 doses of AstraZeneca is needed to get the full protection instead of the regular 2 doses.
The B.1.351 variant can resist the AstraZeneca vaccine. If we do not eliminate the B.1.351 variant in the Philippines, the 17 million doses of AstraZeneca that we have already bought but have not yet arrived will be ineffective against fighting this particular variant from South Africa.
Octa research team says the CoronaVac of Sinovac Biotech has a better protection against the COVID-19 variant from South Africa.
In terms of the long-term goal, you might want to pick Sinovac over AstraZeneca because even though the efficacy for Sinovac is a little bit lower than AstraZeneca, it will protect you against the B.1.351 while AstraZeneca will not.
Meanwhile, the Food and Drug Administration confirmed that Sinopharm has submitted their emergency use authorization application through their local pharmaceutical distributor. But according to FDA Director General Dr. Eric Domingo, they cannot start processing the application because of lack of documents. And because there are no data yet forwarded to FDA, there's no available information yet if the Sinopharm COVID-19 vaccine can be inoculated to senior citizens like President Rodrigo Duterte.
Well, hindi ko pa po masasabi sa ngayon kasi wala pa pong binibigay sa amin na datos, at wala pa rin po kasing published na phase 3 trial results. Ito pong Sinopharm. So until we see the scientific evidence at makita po natin kung kanino nila ginamit yung kanilang clinical trial at saka yung kanilang experience sa paggamit po ngayon sa ibang mga bansa, doon pa lang po natin mabibigyan ng recommendation kung kanino po pwede ang bakuna na ito.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, St. Luke's Medical Center has received the 10,000 doses of Sinovac vaccines it requested from the Department of Health. According to the hospital's chief medical officer, around 2,000 of their employees have expressed their willingness to get the COVID-19 jabs. Joanne Nano tells us why.
To prevent themselves from moderate to severe effects of the COVID-19 and also boost the vaccine confidence of their fellow health workers. St. Luke's Medical Center, in partnership with the national and local government, have kicked off their COVID-19 vaccination program today. According to St. Luke's Chief Medical Officer Dr. Benjamin Campomanes, they have received the 10,000 doses of Sinovac vaccines that they have requested from the Department of Health. Dr. Campomanes explains that although St. Luke's Hospital is financially capable to procure their preferred brand of COVID-19 vaccines, which is Pfizer-BioNTech, they are unable to secure their vaccines due to global vaccine shortage.
It's not a matter of having money. Well, a lot of people have money, but were they able to get vaccines? No, zero. Kaya we're trying to convince our people that we should get it. The best vaccine is the one that we have now and the one available. Eh kung sinabi mong ang best vaccine, Pfizer, o sige, bigyan mo ako ng Pfizer. Eh walang may bigay sa'yo eh.
Hospital management discloses that as of now, there are more than 2,000 of their employees both in Quezon City and in Bonifacio Global City Taguig that are willing to get inoculated with Sinovac vaccines. This number is out of the more than 9,000 overall employees of the hospital. Dr. Campomanes said that they were given 7 days to consume the vaccines. However, if they failed it, they are required to return the excess vaccines that will be then allocated to other hospitals. The national government recognized and thanked one of the country's top private hospitals for their cooperation to help boost the confidence of other people to the efficacy and safety of the COVID-19 vaccines.
So talaga nagdeklara kasi sir, alam ko karamihan sa St. Luke's, Pfizer at AstraZeneca ang gusto eh.
Apart from St. Luke's Medical Center, several private hospitals has kicked off their vaccination rollout, such as Medical City in Pasig and Cardinal Santos Medical Center in San Juan City. Joan Naru, UNTV News and Rescue. We serve the people, we give glory to God.
Health Secretary Francisco Duque III says that only a few government officials were exempted from the COVID-19 vaccination prioritization plan. Meanwhile, more doctors are encouraged to lead the vaccine rollout in private hospitals. Asher Kadapan Jr. explains why.
President Rodrigo Duterte particularly asked Vaccine Czar Secretary Carlito Galvez Jr., Testing Czar Secretary Vince Dizon, and Metropolitan Manila Development Authority Chairman Benhur Abalos to be the first ones to be vaccinated in the COVID-19 vaccine rollout in the country. Health Secretary Francisco Duque III explains that the move aims to encourage Filipino citizens to be vaccinated with any brand of vaccine that becomes available for the rollout, and in this case, the supply that came from Sinovac.
Yung mga yan, pinakausapan mismo ni Pangulo para lang ang kanyang pakay tumaas ang vaccine confidence. So hindi naman yan parang napakamadami, parang 3 doses lang yan, over 600,000. That's really nothing.
This after alleged non-medical frontliners politicians get their vaccine shot in the vaccination program by the national government. Duque said he will look into the matter and report any such incident to the Interagency Task Force for the Management of Emerging Infectious Diseases for corresponding action.
Hindi ko pa kasi nakikita yung listahan na yan, but we will have it investigated kung paano nangyari. Because malinaw naman yung ating prioritization formula na nakalagay po doon, talaga mga healthcare workers lang.
Metro Manila mayors, however, expressed their eagerness in being vaccinated but give way to prioritize the healthcare workers.
Sa ngayon, ang dapat unahin natin ay yung healthcare professionals natin. Kasi sila rin yung pinaka-at risk eh. Lalo na yung mga nasa ER, yung mga nag-handle ng COVID cases mismo, sila talaga yung dapat nating unahin.
Pag dumating yung bulto ng ating mga bakuna at kailangan namin para magpabakuna, para magbigay ng kumpiyansa, walang problema ho. Anytime, anywhere, we will be vaccinated. But right now, ayokong sayangin yung isang bakuna na kailangan ng medical health frontliners natin.
As the COVID-19 vaccine rollout continue, some private hospitals in Metro Manila have finally conducted their ceremonial vaccination today. The inoculation were led by hospital officials to encourage more healthcare workers to participate in the vaccination.
Doctors are still the most able to convince the patients. So if the doctors mismo nagda-doubt, how can they convince the patients to do?
The private hospitals also support vaccination of any brand, although they give freedom to their medical frontliners in its conduct.
We have been very active in the campaign to encourage vaccination, and we have not specified any brand. No? The vaccination drive is premised on the fact that the vaccines that are going to be made available and approved by the FDA of the Philippines are safe and effective.
Officials of the private hospitals expect more healthcare workers to register for their vaccination rollout proper that will commence on Friday. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
There has been an increase in the demand for Sinovac vaccines in the Philippines. This despite the low vaccination turnout in several government referral hospitals where the inoculation program started. Ray Pelayo explains why.
Vaccine czar Carlito Galvez Jr. revealed that there are hospitals that are asking for doses of Sinovac vaccines. However, the 600,000 donated Chinese vaccines are now allocated in different areas in the country, and there are still more groups who are asking for Sinovac.
Sa ngayon, ang problema kami ni USEC ngayon na more than 600,000 na po yung tinatawag nating distribution list po natin. Pero sa awa po siguro ng Diyos, darating na po yung COVAX facility natin. We are hoping na baka dumating po this week or next week.
The country will receive the 44 million doses allocated by the COVAX facility within the year. Around 4 to 8 million doses are expected to arrive until mid-year.
Ang gusto po ng ating mahal na Presidente ay ang lahat ng ating mga mamamayan sa buong Pilipinas ay mapakunahan sa pamumuno ng ating mga healthcare workers. And we will always protect you. At ang sinasabi nga niya, walang may iwan, walang iwanan.
Taguig City is one of the recipients of the Sinovac vaccines. Mayor Lino Cayetano said that the vaccine will help stop the mutation of the virus.
Ang variant ho na to nagkakaroon kapag yung original ho na virus papasok sa tao at papasa mo ulit. So kailangan putulin ho natin yon. Kailangan putulin natin yung transmission ng virus. That's why the best vaccine is the one available today so we can cut transmission.
Taguig City is now preparing for the new normal. Mayor Cayetano said that even with the presence of the virus, people can roam around freely but strictly observing health protocols. Ray Pelayo, UNTV News and Rescue, we serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. Cinemas and other recreational establishments in general community quarantine or GCQ areas will reopen on March 5. However, Metro Manila mayors will implement their own ordinances in their respective areas. JP Nunez will tell us why.
To help businesses to recover from the impact of the COVID-19 pandemic, as well as to provide more jobs for Filipinos, cinemas and other recreational establishments are allowed to reopen beginning March 5, but with limited capacity. However, mayors in Metro Manila will implement different ordinances with their respective cities. Marikina City Mayor Marcelino Teodoro will still implement the city executive order that prohibits the reopening of cinemas and arcades.
Sa Marikina, patuloy na sarado ang mga sinihan, mga arcade. Ayon na rin to sa executive order na aking inilabas at kasalukuyan at patuloy na ipinatutupad. Dahil naniniwala ako na ang virus ay hindi pa rin nawawala at ang COVID-19 cases ay patuloy na tumataas dito sa lungsod ng Marikina.
Mayor Vico Soto of Pasig echoes the decision for his constituents. But Taguig City Mayor Lino Cayetano decides to gradually reopen recreational establishments as public ensures to follow health protocols.
Naniniwala tayo, pag tayo nagkaroon ng behavioral change, kung sanay na ho tayo, may mask, may shield kung kailangan, may distansya, lahat ho pwede natin gawin. So we are slowly or incrementally opening up para makapaghanda tayo sa new normal.
Meanwhile, Quezon City Mayor Joy Belmonte leaves the decision of the reopening to the business establishment owners.
Ang aking lang sinabi sa kanila, allow, not mandated. If the cinema would like to allow to be opened, they will be allowed to be opened, but they are not mandated to be opened. Because number one, when I spoke to cinema owners themselves, marami sa kanilang ayaw naman magbukas. Kasi wala naman daw silang ipapalabas na bagong pelikula dahil sa pandemya, hindi naman nakapag-shooting, no? So number one yan. Pangalawa, kung ang dami-daming restrictions, baka naman hindi naman sila kumita. Diba? Dahil kailangan a certain number of people have to watch in order for them to earn. At para kumita, kailangan pa nilang taasan yung presyo ng panunood, which might turn off naman yung mga taong gustong manood.
In the memorandum circular of DTI, it allows the opening of cinemas from 25% capacity in GCQ areas and 50% capacity in MGCQ areas. Moviegoers will not be allowed to eat and drink inside, and face masks must be worn at all times. Owners should also observe proper regular disinfection and employees should wear proper personal protective equipment. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, presidential spokesperson Harry Roque clarified his earlier remark that Filipinos have been on nearly year-long vacation due to the COVID-19 pandemic. Roque's statement was in connection to the recent order of President Rodrigo Duterte to reduce the number of holidays this year a bit to spur economic recovery. Rosalie Cos reports.
Napakatagal lang po natin nakabakasyon. Halos isang taon na tayo nagbakasyon dahil sa COVID-19. Siguro naman po ngayong nandito na ang bakuna, hayaan naman nating makarecover tayo for lost time, no?
Presidential spokesperson Harry Roque drew flack from the public after he defended President Rodrigo Duterte's earlier decision to reclassify traditional holidays. In a statement, Gabriela Women's Party List Representative Arlene Brosa said the one-year pandemic is an endless nightmare to the poor brought about by the lack of aid and livelihood. While for Bagong Alyansang Makabayan Secretary General Renato Reyes, people who were under lockdown had not been on a vacation, including those who lost their jobs. But presidential spokesperson Roque clarified his remarks. He said that the vacation comment actually meant the work disruption brought by the pandemic in the country. He added the economic team who recommended the additional working days wanted to spur economic recovery.
Hindi naman po talaga bakasyon yan. Kung hindi nakapagtatrabaho, no? Kaya nga ngayon po pwede na po tayong makapagtrabaho sana dahil nagbubukas na tayo ng ekonomiya, kaya naman natin kumita at makapagtrabaho ang ating mga kababayan.
Through Proclamation Number 1107, 3 public holidays, November 2, December 24, and December 31, 2021, are reclassified as special working holidays. Meanwhile, the palace official have also mentioned about the possibility that this can still change since COVID-19 vaccines are arriving in the country.
Pero tignan po natin kung ano mangyari. Nothing is edged in stone naman po. Tignan natin. Baka naman na dahil may bakuna na, makabalik na tayo sa dati at baka hindi na natin kinakailangan maghabol pa. No? Pero let us have faith po ng our economic team at saka katotohanan, napakatagal na po nating nakabakasyon. Yung iba nga, nawala ng trabaho at gusto na magtrabaho. No? So, let's leave it at that po.
Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
The Department of Education has amended its academic calendar for school year 2020-2021, which now ends about 4 months from now. Dante Amento tells us why live. Dante?
Yes, JEGO classes for present school year had been scheduled to end on June 11, 2021 based on the first school calendar released by the Department of Education. But with the revised school calendar, it will now end on July 10 this year. This applies to all public elementary and high schools, private schools, vocational institutions, and higher educational institutions, including state and local universities and colleges that are offering K-12 basic education program. DepEd says this measure could address learning gaps in order to meet the required essential learning competencies. Academic opportunities have decreased based on assessments while students stayed home because of the existing health crisis. But several parents say the extended school year only prolongs the time their children will keep up with school activities.
Para sa akin, pang padagdag lang ng haba ng panahon. Imbis na mabilis matapos ang pasukan nila.
Other parents, however, are in favor of the move, saying that their children can learn more amid the pandemic.
Ako, okay naman po kung hanggang July 10 naman po kasi module naman po kasi sila online kaya parang hindi naman po din masyado na yung mga bata sa pag-aaral Tsaka sandali lang yun, ilang buwan lang yun, okay lang yun. Pabor ako doon. Mas okay nga sa akin, hanggang August pa nga
Diego, as for the next school year, this is still under deliberation. Education Undersecretary Diosdado San Antonio withdrawn or has withdrawn the proposal of a 2-week vacation for learners after it earned criticisms. And that's the latest live. Back to you, Diego.
Thank you, Dante Amento, reporting live. Following calls to resume limited face-to-face learning through pilot testing, some senators want the Department of Education to conduct granular risk assessments in identifying low-risk areas for the pilot implementation of face-to-face classes. Arlene Delgado will tell us why.
The Senate adopted a resolution last night recommending the immediate reopening of schools in low-risk areas. In its presentation in Senate Committee on Basic Education hearing today, the Department of Education said there are over 1,500 schools nationwide under the modified GCQ status that were nominated for pilot implementation of the face-to-face classes. The number includes 36 schools in the National Capital Region in anticipation of its possible shift to MGCQ. However, some senators have urged the department to be more specific in identifying the low-risk areas and not only rely on quarantine classifications.
Kasi masyadong general pa rin yung SECNEPO, yung ganitong presentation kulang-kulang sa detalye, tsaka parang kulang din doon sa science. Kung pwede nga, pag nag-present sa IATF and nag-recommend kay Presidente, nandun na yung pangalan ng eskwelahan, ilang estudyante ba talaga yung papasok.
The MGCQ is a framework, a general framework, but we can go much more granular in terms of risk-based so that when we have these pilot schools, it's not only based on their quarantine levels, but it's also based on their risk. Only epidemiologists can certify and can give us that assurance that they're in fact in a low-risk area.
According to DepEd, a maximum of 50 schools will be allowed per region to participate in the pilot testing.
That is duly noted with the assurance that it is, as I mentioned, consistent with our framework to really look at it at the lowest risk areas. We really need expert technical input on that side.
Under DepEd's proposal, a blended approach or a combination of physical and distance learning will be done for the pilot face-to-face classes. A pre-assessment will be conducted to check the readiness of pilot schools, such as the implementation of health and safety protocols. 1 class will be allowed per grade level in small schools and up to 5 classes per grade level in large schools. A maximum of 20 students will be allowed per class, depending on the size of the classroom, to ensure physical distancing. It shall be voluntary for students with written consent from the parent. All teachers and non-teaching personnel are allowed to participate except those aged 60 years old and above and/or has medical conditions. If a participant exhibits symptoms while in school, the principal, in consultation with the local government unit, may declare suspension of classes depending on the gravity of situation and advice from local health authorities. Once classes are suspended, the school will be subjected to 1-week complete lockdown for disinfection. The DepEd recorded 1,078 learners, teachers, and non-teaching staff who have contracted COVID-19, with the highest in Quezon Province. Arlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God. Travel authority from the Philippine National Police as well as medical certificates are no longer required for domestic travel. But police authorities are urging the public to strictly follow health protocols implemented in their destination areas. Leia Ilagan will tell us why.
The Philippine National Police no longer issues a travel authority for domestic travel via air, sea, or land. This after the government's pandemic task force has eased the travel restrictions by canceling the usual travel requirements that also include a medical certificate. Joint Task Force Coronavirus Shield Commander and Deputy Chief for Operations Police Lieutenant General Cesar Hawthorne Binag says policemen manning the border control points will only look for the negative result of the RT-PCR if a local government unit requires it.
Travel authority issued by JTF COVID Shield and health certificates shall no longer be required. No? So testing shall not be mandatory for traveler except if the LGU of destination will require testing as a requirement prior to travel, and such shall be limited to RT-PCR only.
Under the new protocols, no traveler shall be required to undergo facility-based quarantine unless they exhibit symptoms upon arrival at the LGU of destination.
No traveler shall be required to undergo quarantine unless they exhibit symptoms upon arrival at the LGU of destination.
The PNP also appeals to public to always observe minimum health protocols to avoid the virus transmission.
Patuloy nating pinaalalahanan ng ating mga kababayan na sundin pa rin natin ang ating minimum health protocol, yung ating quarantine protocol, at patuloy pa rin tayo mag-ingat kahit na binuksan na ang ating ekonomiya at dinagdagan pa ang iba't ibang social activities natin.
Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
The Department of Health, or DOH, reported 1,783 new COVID-19 cases today, bringing the country's cumulative total to 582,223. The DOH said that 6%, or 35,056 cases of the overall tally remain active. Of the active cases, 90.1% have mild symptoms, 4.7% are asymptomatic, 2.5% are in critical condition, 2.2% are in severe condition, and 0.84% are in moderate condition. It was also reported that 20 more patients died, bringing the death toll to 12,389. Also, there were 14 additional patients who recovered from the viral illness, pushing the total number of survivors to 534,778. Meanwhile, the Social Security System, or SSS, is pushing for the higher utilization of its digital platforms as it aims to improve the ease of doing transactions with its members. Dante Amento tells us why.
20 services can now be accessed on the my.sss portal, which include applications for calamity loan, pension loan, retirement benefit, unemployment benefit, and funeral claim. Members can also use the online portal for the submission of requests for member data change, for simple corrections for members, and submission of sickness benefit reimbursement application for employers. SSS Benefits Administration Division Vice President Norma Doctor said this will help their members to avoid visiting their main offices personally due to the COVID-19 threat. Aside from the website, Doctor also shared their plans to further enhance their mobile application.
But for the complex correction, like yung magpapa-change ng mga date of birth, these are not yet available online. So kailangan pa nilang pumunta sa branches. But for simple corrections lang, they can already do it online.
The agency reported that during the pandemic, more people used their online platform. The agency's electronic channel accounted for 75% of the total in 2020, up from around 35% in the previous year, while the online registration reached to 10.6 million. The SSS assured their members that their online accounts are secured.
Tayo naman po ay nag-i-invest po ang SSS for cybersecurity. So halos sa araw-araw din po, kumbaga sa nakikipaghabulan tayo sa kanila na upang hindi mapasok ang ating mga computer system installation.
Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, the governor of Texas has lifted most of the state's coronavirus restrictions and will allow businesses to fully open next week. Miguel Rey de Leon will tell us why.
Texas Governor Greg Abbott issued an executive order Tuesday which lifts the state's mask mandate as the medical advancements of vaccines and antibody therapeutic improved, saying that Texas now has the tools to protect Texans from the virus. Likewise, all businesses and facilities in the state is allowed to increase its capacity to 100% and will fully reopen next week, March 10.
It is now time to open Texas
100%.
The governor discussed the advancements of the state, such as the rapid increase of vaccines, with nearly 5.7 million administered, and is now administering almost 1 million shots each week. Additionally, by the end of the month, every senior who wants a vaccine should be able to get one. However, he adds that while the restrictions are lifted, Texans should continue to follow medical advice on preventing COVID-19 and that personal responsibility for family members should remain to keep them safe. Other states and cities have likewise started rolling back precautions. In Mississippi, Governor Tate Reeves also announced on Tuesday that the state was lifting rules for businesses and doing away with county mask mandates. On Monday, CDC Director Rochelle Walensky strongly cautioned against the very rollbacks that Abbott and Reeves were about to implement. President Joe Biden echoed the same concern, urging Americans to still practice COVID-19 restrictions, including the wearing of masks. Miguel Rey de Leon, UNTV News and Rescue, USA. We serve the people, we give glory to God.
The Malaysian government has decided to end the movement control order in some states, but interstate travel is still not allowed. Maya Marquez will tell us why.
Malaysia announced that it will ease COVID-19 restrictions and reinstate the Conditional Movement Control Order or CMCO for Selangor, Kuala Lumpur, Johor, and Penang starting March 5 to 18. While the other states in Malaysia, Negeri Sembilan, Kelantan, Perak, Kedah, and Sarawak will remain and continue under CMCO, according to Senior Minister Security Cluster Datuk Seri Ismail Sabri. Melaka, Pahang, Terengganu, Sabah, Putrajaya, and Labuan will be placed under Recovery Movement Control Order RMCO. Under CMCO, some restrictions will be eased, including SOPs for traveling. Inter-district travel will be allowed from March 5 except for Sabah, while interstate travel is still banned for all states. It also includes the allowing of more business sectors to remain open. Dine-ins and restaurants will be allowed but will still be controlled to 2 persons per table. However, all gatherings, religious or social, will still not be allowed. Maya Marquez, UNTV News and Rescue, Malaysia. We serve the people, we give glory to God.
An Eastern Chinese provincial court in China has upheld that homosexual behaviors can be considered a personality disorder in a recent verdict despite appeals. Nina Bascon reports.
Homosexuality has been a very controversial topic. In a recent verdict of Sutian Intermediate People's Court in China against a lawsuit filed to a book publisher, it was ruled that the textbook's definition of homosexuality as a psychological disorder was not an error. A Hong Kong social worker and LGBT activist, Jia Yong Ao, sued Jinan University Press for publishing mental health education for college students as the textbook cited that homosexuality is a common mental disorder. The publication included homosexual behaviors together with cross-dressing and fetishism as psychological disorders. Au fought to bring the publisher to court, demanding apologies and removal of the said definition. But her case was rejected twice, in 2016 and in her recent appeal, due to being random and baseless, according to the South China Morning Post. However, Au believes that the evidence she presented was enough, and the decision was just to reduce controversies. The China LGBTQ community has also expressed support in Au and disappointment in the court's decision. According to Ah Kiang, a spokesman of a support group for the queer Chinese community, the editors and the court's description to homosexuality is inaccurate. The World Health Organization has declassified homosexuality as a psychological disorder in 1990. In a publication, WHO mentioned that homosexual behavior is an aspect of human sexuality. This has also been decriminalized in China in 1997. Meanwhile, Au will continue the fight and coordinate with her lawyer to address the situation. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
A study showed that those obese or overweight might experience a weaker immune response post-vaccination with the Pfizer vaccine. Mavian Dog tells us the details why live. Maeve?
Italian researchers identified a relationship between obesity or being overweight with the effectiveness of the Pfizer vaccine. Less protection might be provided against COVID-19. A study regarding the immune response after 2 doses of the BNT162b2 vaccine was conducted with 167 healthcare workers, both female and male, aged from 23 to 69 years old. It was concluded that those with a low body mass index or BMI, those younger, and the women experienced an effective response with an increase in antibody concentration. They found that with obese and overweight individuals, their continual low-grade inflammation could lessen the effectiveness of immune responses, like those excreted by T cells, which eliminates infected cells. It is also important to note that the obese experience COVID-19 infections longer than those lean in physique, so a more efficient vaccine which will optimize immune response in overweight individuals must be made, said by the researchers. The paper, however, is non-peer-reviewed and therefore it is not recommended yet to guide clinical practice. With this, the group of researchers hope that major studies would repeat this experiment to consider larger doses for overweight individuals. Kat?
Thank you, Mavian Dog, for that report. And those are the reasons behind the news in other parts of the globe. I am Kat Dumaraos. Good evening.
Testing czar Vince Dizon is sending additional doses of Sinovac vaccines to Valenzuela City. This after more health workers and frontliners in the city expressed willingness to get inoculated with the Chinese vaccine. Janice Inhente reports.
The Valenzuela city government believes that the first day of the inoculation program helped convince not just health workers and frontliners but also their constituents to be vaccinated. From 250 health workers and frontliners who've shown willingness to be vaccinated, Valenzuela City has now recorded more or less 700 frontliners who registered for the inoculation.
Ngayon bumibilis na dahil nakakita nila na safe naman, and sa totoo sabi ni Dr. Alitam, dumadami yung nagpaparegister. In fact, today excited kami kasi sa overall population ng Valenzuela, pag nakita nila itong mga litrato, mas dadami yung mga magpaparehistro para sa mga incoming na mga dadating pa na bakuna.
The city received 750 doses of Sinovac vaccine, which was allotted for 375 health workers and frontliners. According to testing czar Vince Dizon, the registered vaccine in Valenzuela City now is higher than the available doses of vaccines that the city receives. Because of this, Secretary Dizon is planning to talk to Vaccine Czar Secretary Galvez to allocate more doses of Sinovac vaccine in the city.
Nakakatuwa is, sabi nga sa akin kanina ni Dr. Amarga, is over ang kanilang demand sa supply. Ibig sabihin, mas marami ang mga nagrehistro at gustong magpabakuna kaysa dun sa natanggap nilang bakuna. Dahil doon, sasabihan ko ang DOH at si Secretary Galvez na magpadala pa ng mas maraming bakuna dito sa Valenzuela.
Today, Valenzuela City has started their vaccination rollout and around 70 health workers and frontliners received their vaccination. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippines could have the capability to produce vaccines, the country's Department of Science and Technology says. Marvin Calas reports.
With investments and cooperation between the government and the private company, it would just take 1 year to establish a vaccine-making facility in the Philippines, according to the Department of Science and Technology. DOST Undersecretary Rowena Guevara says modern technology is now available for this.
What we found out was that because of the modernity of technologies today for producing vaccines, a fill and finish facility can easily be done within 1 year's time. And we have been in touch with the Department of Trade and Industry Board of Investment and the National Development Corporation, or the investment arm of DTI, and they are willing to co-invest with a local company that is willing to do local manufacturing of vaccines.
Attorney Joey Ochave, Senior Vice President for Social Partnership of Unilab Incorporated, added that there would be a need to enhance the country's capability in terms of manufacturing vaccines in case of a pandemic recurrence.
we've said before, and events now have proven that, that in any vaccine supply agreement, in fact, that we entered before, there is always a provision saying that they will not be obliged to supply us in case of a pandemic and their home governments have prevented them or prevent them from supplying outside of their home countries.
Meanwhile, one of the biggest healthcare pharmaceutical companies in Asia has expressed its support. According to the company's chief business officer, their company has establishments in the Philippines such as a low-temperature storage facilities and a digital platform technology promising a potential use for the manufacturing process. Aside from the company's 4 major warehouses in the country, it also has vital experiences in handling sensitive vaccines for nearly 100 years of practice in the industry.
Vaccines are very sensitive products and require special type of handling, not only storage facilities. It in fact goes beyond the storage facilities, and it's important that the people that handle these products really do have the experience and the know-how, have the technology to support it.
Although this implies a need for a greater budget that needs to be earmarked for the project's realization, this would also mean that the Philippines, being a potential vaccine producer, could provide security when it comes to sufficient supply of vaccines for Filipinos. Marvin Calas, UNTV, News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, March 3, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. Abangelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.